Hi there. Today we're going to be talking about restless leg syndrome, which is an urge to move the legs. Very unpleasant sensations that people will experience. They say it's like having creepy crawlies. They tend to be worse at night or when you're relaxing and are relieved by moving. They can be a serious disruptor of sleep, which is why I'm tying it into this series we've been doing.
My legs!
Just like any other sleep-related problem, there are many conditions that can cause restless legs, or at least contribute to it. One of the most common we find is iron deficiency. And even in people who aren't anemic, if their stored iron is at a low level, sometimes replacing that can be very helpful. Don't take an iron supplement without talking to your doctor first, because getting too much iron can do a lot of damage. Other deficiencies like vitamin D, or B12, or low thyroid can contribute, and diabetes can cause problems with this also. There are a lot of different substances that contribute to restless legs. Caffeine is one of them, alcohol is another. I know it seems like I harp on those all the time, but the research really backs up that these can be detrimental to a lot of conditions that contribute to sleep problems. There are several different medications that can contribute to or cause restless legs as well. Antidepressants are some of those. Metoclopramide, also known as Reglan, which people take for stomach problems, can really cause issues with this too. Antihistamines like diphenhydramine or hydroxyzine, which sometimes are used for their sedating benefits, can cause restless legs. So sometimes they are the wrong choice for people. Also, people who are on atypical antipsychotics or the old-timey antipsychotics like Haldol or Thorazine can cause limb movements anyway, but certainly restless legs. Obviously, the next step would be to talk to your doctor and see if a different medication may be more appropriate if that's the culprit. Things that you can do to help restless legs. One is do what we call alerting activities, things that wake your brain up when you are relaxing or getting ready to go to sleep. Brain games, things that stimulate or challenge your mind can help calm down your nervous system. Get exercise, because moving your limbs can really help to tire them out, whether that is biking or walking or any other activity like that. Sometimes people also will get relief with either soaking them, sometimes in Epsom salts, which are magnesium, and that's known to help with leg cramps and muscle spasms. And some people do really well with giving themselves a leg massage prior to going to bed. Thankfully, restless legs responds very well to medications if correcting any of the underlying problems doesn't help. The medication choice depends on the patient's age, underlying other problems, medications they might already be taking, and the severity of their symptoms. Thankfully, we usually do not have to use very high doses of these medications, and often we start with medications that are anti-Parkinsonian drugs, meaning we use them to treat Parkinson's disease. People with Parkinson's tend to have involuntary muscle movements, which is why we use them here. The mainstay of treatment is carbidopa, levodopa, also known as Sinemet, and it tends to work very well to help control these. Other medications that we often use are pramipexole or ropinirole. We don't like to use these in people who have compulsive or impulsive behavior issues, because sometimes the dopamine can make those worse. Gabapentin and Lyrica or pregabalin can also be used because they help calm the nerve sensations that lead to these uncontrollable impulses of the nerves. Some other medications that are used, but less frequently, are carbamazepine or clonidine and other anti-seizure medicines. Hopefully, this helps give you some tips and ideas on medications that may be useful if you're suffering from restless legs. Don't forget to like and subscribe, and stay tuned for more.